Hi guys, how are you? I hope you are all doing well. So today's my topic of discussion is detailed explanation of the primary motor cortex. Okay. In previous video, I explained all about the lobes of the brain, especially the cortex of the brain, frontal cortex, parietal, occipital, temporal cortex, and lastly insula. Okay. So today I explain the clinical importance of the motor area which is present in the frontal lobe just anterior to the central sulcus. Okay, so I go explain with the diagram. First I draw the diagram and then explain. Okay, so this is the central sulcus of the brain. Okay, this is the central sulcus of the brain. So anterior to the central sulcus, what is this area which I draw in orange color? This is the primary motor area. Okay, primary motor cortex. Its name is primary motor cortex. What its function? Its function is voluntary control of the movements. Okay, its function is voluntary control of the movements. And how it controls the voluntary movement, I explain with in this lecture. Okay, so this is the primary motor cortex. I just draw the structures. The primary motor cortex contribute in the spinal cord. Here is the nucleus which is present in the brain stem. One nucleus, two nucleus, three nucleus, four nucleus. Okay, and some of the nucleus which is present very low in the spinal cord. This one, this one, this one. Okay, so what the primary motor area do? It control the voluntary movement. Okay, it control the voluntary movement by two pathways: corticobulbar pathway and corticospinal pathway. ठीक है, corticobulbar pathway and corticospinal pathway. So first I draw the corticobulbar pathway which go down this area and communicate with the nucleus which is present in the brain stem. Okay, all the nucleus which is present in the brain stem, and his nerves goes for the specific muscles related to that nerve. Okay, so these are all nerves are the cranial nerves. So the first nerve is cranial nerve 5. Okay, what are the name of this cranial nerve? It's trigeminal nerve which have three branches: ophthalmic, maxillary and mandibular branch. Okay, second one, this is seventh cranial nerve. Seventh cranial nerve is facial nerve. Okay, seventh cranial nerve is facial. Then there is this nucleus is a combination of more nucleus, so it innervates more cranial nerves. Cranial nerve 9, 10, 11. Okay, all these cranial nerve are supplied by this nucleus, okay, which is in the brain stem. Cranial nerve 9, what is the cranial nerve 9? Glossopharyngeal nerve, 10th vagus nerve, 11 accessory cranial nerve. 11th nerve have two branches, its spinal branch and cranial branch. So 11th is accessory cranial branch. Okay, and the last one is this is 12th cranial nerve which is hypoglossal nerve. Okay, the communication of the prefrontal cortex Okay, primary motor area, precentral gyrus, which I named here, this area precentral gyrus is the name of this area, and functionally its name is primary motor cortex. Innervate these cranial nerves. Okay, these all cranial nerves. Okay, so this pathway is called corticobulbar pathway. Corticobulbar pathway. And the second pathway which I draw here, which goes down and communicate with the deep and very low nucleus in the spinal cord. Okay, their tracts are very deep in the spinal cord, and these cranial nerves, all these are the cranial nerves. Okay, 5 7 9 10 11 12, and these are the spinal nerves which communicate with the muscles of your extremities. Okay, these control the muscles of your extremities. Okay, this is your muscle. Okay, so this tract name is corticospinal tract. Okay, this tract name is corticospinal tract. So the tract which control the cranial nerve 5 7 9 10 11 and 12 are corticobulbar tract, and the tract which control the muscle of the extremities, your skeleton muscles, with these nerves pathway are called corticospinal tract. Okay, these two tracts are related with this area. So how I explain how this area primary motor cortex control the areas of your body. Okay, so second I gonna explain to you this is the lateral view of the brain. Okay, and the spinal cord. Now I draw the anterior view of the brain at the level of this primary motor cortex. Okay, primary motor cortex, at the level of primary motor cortex I give you the cross section and tell you the somatotrophy of that area. Okay, how it be the how this area defines which control of the body is controlled by that area. Okay, so first I draw the anterior view at the level of the primary motor cortex. Okay, this is cross section anterior side. Okay, at the level of primary motor cortex. This is right hemisphere, this is left hemisphere. Okay, this is right hemisphere and this is left hemisphere. Okay, and this is here where the dural septa can cross at the center. Here the dural septa cross. Okay, so how I draw this diagram, this diagram explain the clinical importance when there is stroke, any blockage in the vessels which supplied by this area primary motor cortex. Okay, primary motor cortex, and what type of the clinical importance, what kind of type of symptoms appear in motor area. Okay, so guys, the medial aspect of the primary motor cortex here is control your foots. Okay, your foots are control this area, your knees controlled by this area, your hip joint is controlled by this area. Okay, your arms and hands are controlled by this area, and your face and neck region, your face and neck region muscles are controlled by this area. Okay, and your tongue is controlled by this area. Okay, so all these area explain about the clinical relevance about this area. Okay, so all the nerves, okay, the axons which comes out from this area. Okay, these are all the axon which take the information of the motor activity. Okay, motor activity, all these are axons. which goes down. Control the what are the pathways? Control the corticobulbar pathway, control the corticospinal pathway. Okay, so this area, I explain the blood supply of this area. This area is controlled by, these are our blood supply. This area is controlled by, this green area is controlled by anterior cerebral artery. Okay, and the second area, this area's blood supply is controlled by middle cerebral artery. Okay, what are the importance of these arteries, anterior cerebral artery and middle cerebral artery? The importance of this is, and if there is a stroke of the which artery? Anterior cerebral artery. If the stroke of this artery, anterior cerebral artery, see the area of supply of anterior cerebral artery, this medial area. Okay, these all medial area. So the medial side of the primary motor cortex is controlled by which area? The foot, the legs and the hip joint. So if there is an anterior cerebral artery stroke, the clinical symptoms appear like your foot appear on the foot, legs and hip joint, like your motor activity, the paralysis of this area, the paralysis of lower limb. Okay, and the middle, if there is a middle cerebral artery stroke, middle cerebral artery supply which area? You notice this area, this area, this area, this area, this area. Okay, and this area is control which functions, like your hands, like your mouth and facial expression muscles, like your tongue muscles. Okay, if there is a paralysis of middle cerebral artery, then the paralysis of which structures of your body? Your face muscle paralysis, your tongue muscle paralysis, your upper extremity paralysis. Okay, like this type of features appear if there is a stroke of these two arteries. Okay, if there is its clinical importance is very important, that anterior cerebral artery is innervated which area of the our body? The lower extremity. If anterior cerebral artery stroke, then lower extremity is paralysis. And there is a, if there is a middle cerebral artery stroke, and then there is a which part of the area is affected, which part of the area is paralyzed? Your upper extremities, your face, your tongue, like all these structures are affected if there is middle cerebral artery palsy. Okay, so what are the name of this diagram which I draw with respect to the regions, like this face region? This is called motor homunculus. Okay, motor homunculus. Okay, this diagram is motor homunculus with respect to the diagram of the arteries which supplied that area. Okay, and if there is a stroke of the anterior cerebral artery, there is a paralysis of lower limbs. And there is a middle cerebral artery stroke, there is a paralysis of face muscles, tongue muscles and neck region muscles, like upper extremities are affected. Okay, okay guys, so this clinical importance is very important. You must note this lecture and made the proper notes. Okay, for the understanding the basic of the clinical importance of this area, primary motor cortex, which is present anterior to the central sulcus. So guys, I hope you are all understand this lecture, and must watch this lecture and must watch previous lecture. I go explain the all the areas of the brain with respect to the cerebral cortex. Okay, so guys, I hope you enjoy this video, and please like, share and subscribe this video, and got the concept of the clinical relation of this area of the brain. In next videos I go explain the other areas and their clinical importance. Okay, with respect the diagrams. So guys, please like, share and subscribe my channel, and please press the bell icon for receiving any new video. Okay, so guys, goodbye, be happy.